Hello, and welcome to this episode of Young Physician Network's Guide to DOing Med School. I am this episode's host, Tam. I currently go to Kansas City University in Joplin, and I'm a second year, and I'm here today with my friend.
Hi, my name is Ambrose. I am also a second year med student here at Kansas University.
All right, and then today we are going to be talking about mentorship. Now, mentorship is very important in medical school because it really serves as a guide for working your way through and making sure that you have a resource you can rely on so that way you can really succeed throughout medical school and also later in your career. So first of all, I want to talk about kind of how our experiences with mentorship and how we found mentors for ourselves. So I'll kind of get started with my personal mentorship experience. So I was introduced to the concept of mentoring when I was in high school. I was lucky that there was a local mentoring program through a outside nonprofit where they had lots of amazing, successful women donate their time to be mentors to high school girls. And that's actually how I got some of my first shadowing experiences, which was really cool. And then once I got into medical school, I chose to use more of a peer mentor. And I was lucky that our medical school had a peer mentorship network. So I was able to sign up for a peer mentor, and she really helped me throughout all the first year and navigating everything that came with it. All right, Ambrose, how did you kind of find all the mentors in your lives?
Yeah, that's a really great question, Tam. So in terms of finding a mentorship, I come from a background as a first-gen medical student. Coming from a background with barely anyone to guide me, I basically had my sisters who helped guide me for the first 20 years of my life. Entering college, I was kind of lost. Both me and my sisters were kind of lost. So I kind of went to undergrad not knowing what to do. And then it wasn't until the end of my undergraduate education that I realized that I needed to find a mentor. So I started to just cold emailing people. And then that's how I was able to get on track. Entering med school, I also decided to cold email a bunch of people, and then was able to find a chief of surgery mentor who has guided me throughout med school. I also used the same program as Tam did, where I had a peer mentor who helped guide me throughout my first year of med school.
All right. And then how did you go about building a relationship with your mentor? So I know for me, it was really hard, especially when I was in high school, trying to figure out how to be a good mentee and then trying to figure out how to better connect with my mentor. So I really found it difficult to kind of put myself out there and be vulnerable with my mentor at first. But I think I did eventually find success with trying to open up about myself, because you can't really receive good advice unless you're being honest and truthful about your shortcomings, right?
Yeah, so like you said, I did have a similar mindset as you, Tam. When I first had my very first mentor, I was kind of afraid to basically share certain aspects of my life and be comfortable sharing with my mentor everything. But then as I continued with them, I realized if I'm not being honest with them, if I'm not sharing what I need when I need help and whenever there's something that I need, then I won't be able to make the most out of my opportunity and this experience. So from there on, I just slowly began to share my experiences, my thoughts, my feelings slowly. And then from there on, I just developed a relationship with them that I wouldn't change for anything else.
Yeah, I was going to say that's really great, because I know for me specifically, especially even now with I feel really bad for my peer mentor I had here, because I know I definitely wasn't being honest. Anytime she would ask me, how are you doing in school? I'd be like, oh, I'm doing great. And then meanwhile, I'd be really struggling with scheduling and timing and things like that, when I could have just opened up and been honest, and she could have probably given me tips. Is there anything that you specifically did or asked your mentor that you think really helped build that bond?
That's a really good question. Honestly, I asked them what was their most difficult challenges the first year of medical school and what they would do differently to help them. To be honest, that is a kind of personal question, but it really helped me navigate through med school and try to learn from their mistakes. So I feel don't be afraid to ask questions that you feel can be out of the comfortable range.
No, I get that, because that's a really great question to ask, because I feel like I had the most success from my mentors when I was finally brave enough to ask, how did you overcome your failures or what you consider failures? And I feel like that's when they gave me their best advice. For example, during high school, I had problems with like opening up, not wanting to talk to people, but it was through talking to my mentors that I had there where they were able to say, no, you'll never succeed if you just stay closed and you don't try to open yourself up to those opportunities such as like networking, just meeting new people. So that's kind of what helped open up my eyes because they did talk about losing opportunities like that. All right, so kind of moving on, what kind of advice do you ask your mentor for, do you find? So I know for me, when I was talking to my peer mentor, I specifically asked about advice for school. So I asked a lot of study methods, and I did find that really helpful. I know she was the one who introduced me to the concept of I don't have to do Anki like everybody else was, because that was a really scary time coming here. And it seemed like everybody was using Anki. And I did not know how to use it. And I was not brave and I did not want to figure out how to use it. But she wasn't using that. So it made me feel more comfortable kind of using my own study methods. I think another big question that I asked like my peer mentor was just advice. So this is something you can do if you are seeking mentorship through somebody at school from a student. It was just like really nice getting perspective on certain professors and how they teach and the best way to overcome their material. Now, that's not going to be applicable to everybody because like Ambrose has a mentor that isn't specifically at the school, but that's something really helpful that I think you can ask if you find mentorship through an older student. But I think other great advice that you can get from your mentors. So, for example, outside mentors, I think great advice I got from them was just personal skills. Like, I know I definitely worked on like practice interview questions with my mentor, and they gave me really amazing advice on how to open it up and how to look better during those kinds of processes. So, what kind of advice do you really ask your mentor for, Ambrose?
In terms of my mentor from out of the school, I pretty much asked her like anything from residency, medical school, navigating through med school, and then like how to build my resume, and then like what I should do to match the dream specialty that I want. In terms of my peer mentor here at school, I would ask like how I could find a balance in life while attending medical school. Cause like as many of you guys know, medical school is like it could take up all of your time and you feel like all you're doing is studying. So as someone who has already been through the first year of medical school, I always try to ask, how can you do this without giving up other aspects of your life? How can you balance it? How you can find time to find friends? Also, I would ask them tips on what they would do to do well in a class because like, having gone through it, they know like, oh, which part you should focus on and which part that you can spend less time on. It's really a mix of both.
Yeah, that's super great because I know life balance is a really tricky one, and every student, every single doctor, every single resident, I'm sure, has a different perspective on how to balance medical school. What do you think the best advice your mentor has given you would be? I know for me, I kind of already touched on it a little bit. I think the best advice I've received from different mentors throughout my life was to make myself uncomfortable on purpose because it can be really scary. You want to stay inside of your box. You want to not talk to other people. You don't want to go outside of your comfort zone. But I've found my most success when I have pushed myself outside of my comfort zone. I've pushed myself to try something new and I've made new friends, or I've tried a different study method that I thought wouldn't work for me, but then it's really working out great for me and I'm doing a lot better in my classes. So I think pushing yourself outside of your comfort zone is really one of the best pieces of advice I've gotten.
For me personally, I think the best advice I've gotten from my mentors is that it's okay to fail sometimes because life is hard and then medical school is hard and doesn't necessarily always work out your way. So what matters is more of whether or not you tried your best, how you will overcome this failure and how you will come back stronger. As many people would say, what doesn't kill you makes you stronger. So the fact that you failed this time and then you have the motivation and you have the dedication to come back and push even stronger and better, that is all that matters. Personally, I have failed on an exam, for example, and I was on the verge of failing and then I was really scared. But then I took that motivation And then like I literally studied twice as hard. I studied every day and I was able to get the highest grade I've ever gotten on the next exam. And that just shows like if you don't give up, even if you fail, it's fine because failure is the first step to success.
Before we introduce our second guest, we wanted to thank you again for listening. Our podcast is made for students by students and hosted by the Missouri Association of Osteopathic Physicians and Surgeons, or MAOPS's Young Physicians Committee. Each season will cover a different year of medical school, season 1 being year 1, covered through 10 different episodes, each hosted by a different medical student covering a different aspect of success. If you'd like to support our work, you can follow us on Spotify or go to maops.org, that's MAOPS.org, to donate. Thanks for joining us, and now back to your scheduled programming.
All right. Also joining me for this episode on mentorship is a special guest. I will let him introduce himself.
Hello, I'm Dr. Jared Nichols. I am a board-certified physician in family medicine and OMT, and also osteopathic neuromusculoskeletal medicine.
He was gracious enough to give me his time so I can ask him some questions about mentorship, just more from a physician and once you get practicing role, because I know sometimes it can be nervous or daunting thinking about mentorship as you go along the line. So I really wanted to get that extra perspective. So thanks for being here. The first thing I kind of wanted to ask you about is what role do you think mentorship has played in helping you become the physician that you are today?
I would say mentorship has been vital in my development, both as a person and also as a physician. I remember when I was in college, I was approached by the men in my all-male a cappella singing group, and basically my behavior was not to the level that they would have liked to see me be. And they said that in a very kind way. But essentially, I remember early on, I had a mentor in that group that was kind of my big brother. And he really helped shape how I was supposed to act in certain settings. And a little bit about me is I was an only child. And so growing up as an only child, you kind of just do what you want to do at home, within your parents', blessing. And so I didn't have a lot of siblings to kind of check myself. So I will have to say I had a rough go at it for a little while, but moving on to medical school, I was so blessed to get involved in the MAOPS Wetzel program and just learn more about the programs within MAOPS. And then when I got into residency, I became a Wetzel Fellow. And essentially what that means is I was given a mentor. My mentor was Mark Pelicandio out of St. Louis, Missouri. And so he just called up on me and, talked me through life, and I just had an older individual to talk to me about the stages of life that I was going through and kind of help me get through that part of residency. And I'll tell you that residency was extremely difficult for me. Not so much the book knowledge, but more just the day-to-day grind. And I had a lot of issues with my family and my marriage at the time. And I'm blessed to still be married today and to have many children with my wife. And that's all a testament to having good people speak into me. So how has mentorship played a role in where I became today? I would say that I would not be successful and as put together today without people speaking into my life and helping me along the way. One of the aspects that I realize, especially now as a professor at Kansas City University, is that I see these students come in that have never had any exposure to the medical world. I was one of those as well. I had a degree in music at Truman State University in Kirksville. And then I just didn't know how to act in a medical setting. It's just different than other professions and the things that you deal with and the stressors. It's just different. And I think being around people, especially as a student, looking up to my fourth year students when I was a third year and the residents, and just to have someone above you guide you along and teach you the things that you don't even know to ask was extremely beneficial.
Thanks, Dr. Nichols. I really appreciate that perspective because I think oftentimes we don't talk about how mentorship doesn't have to be strictly professional. It can be growing your character and growing your, I don't want to say personality, but just growing who you are as a person. It doesn't necessarily have to be strictly business or strictly one thing. It can really help with that development. I also really appreciate what you said about making sure that you were successful and having that guidance, especially as you were a resident and as you were coming up, because I think oftentimes students mistake that, oh, I can only receive mentorship once I'm a student. And then once I'm thrust into the world of residency and fellowship and going forward, like I might have to serve as the mentor and I can't continue receiving that mentorship. So I think it is really good for everybody and students especially to know that that mentorship relationship does not have to end once you graduate.
Oh, absolutely.
So I also wanted to ask you, how has mentorship kind of changed from when you were a student to becoming a resident and or to becoming a more practicing, tending, and or as a professor, since you do serve as a professor here at KCU?
Yeah, so when I was a student, a lot of things were just trying to learn about the profession, learn about life, learn about the things that I just didn't know existed. And that was a big aspect of it. And just getting support from people that have been there and done that. When I was a resident, it started looking more towards talking with my attendings about what type of practice I want to go into. What type of profession am I going to go into? I thought I was going to start a private practice, and then reality hit where my wife was pregnant with our third child, and I was doing a lot of locums work, doing ER every other weekend, and just the thought of going full-time ER, trying to start another practice on the health exchange insurance and have another baby with no benefits just really scared me. Scared me into being logical and picking a choice where being an employed physician at that time in my life was the right choice. And now I have no regrets because being in academics has given me a work-life balance that I cannot foresee me having in a private clinical world running my own business. And especially when my children are so young, that is of the utmost importance to me. And hearing a lot of my mentors speak about the importance of their family, what they wish they would have done better, talking to those divorced doctors that don't see their children and what they would have done differently, I really heeded their advice at that time. Now that I'm a professor, my mentorship is more coming to my bosses and my mentors of how would you deal with this situation with your employees, or how would you ask for a raise, or how would you look at these different situations. And so now I'm more of a people managing position where I'm the director of the undergraduate fellowship here. It's definitely been a different challenge that I've experienced than dealing with just patients and finances and all the other aspects that, go into becoming an adult. So I would say that the life aspects really have kicked up into that is now a bigger deal, talking about mentorship. Before, when I was a student and I'm looking at getting married, I didn't have to talk about my children and work-life balance as much because everything was new. And nowadays, that's a much bigger part of things. My buddies are starting businesses, or they're in successful businesses, or they're employed physicians. And so I'm leaning on them and their guidance is, hey, what does that look like? Is that something that I should be looking into, or should I just keep going the same direction that I'm going? Those are how life has changed. And really, it's just basically as I've grown throughout my life, the questions change because my life has changed.
Yeah, it's really great to hear about how your mentorship and all those relationships kind of evolved with you. One of the important things that I talked about a little bit earlier was how important it is to be open and honest with somebody who is mentoring you just about anything, especially if you do want to receive good advice. So I really like when you said that you were receiving advice and taking advice from people who did have maybe failed relationships with their families, and how you were able to kind of take that and move forward and really benefit from their advice because you were open and honest about your family life and wanting to really succeed in balancing that with practice and medicine. I do really appreciate hearing that mentorship is a constantly evolving thing. It's not just one thing. You're always moving on, and you can always ask different questions based on where you are in your life.
Yeah, the mentor that I had when I was a Wetzel Fellow with MAOPS was not the same mentor that I relied upon for all those other things I mentioned. So there was many, many people that have spoken into me and spoken the truth and just positivity into my life.
Yes, I think that is a great thing to touch on that I don't think we've touched on yet, which is that you don't have to be stuck with just one singular mentor your whole life. You don't have to stay loyal to just the one mentor you've had since undergrad or since medical school, but you can really make mentorship relationships with almost anybody in your life.
Yeah, I was talking to my daughter last night who just started piano lessons, and I was telling her that there's a reason why I don't teach basics. I don't have the patience to do certain things, but I have the life skills to talk and speak into people in certain aspects of their life, but not in all aspects. I think that's very important to recognize, as you just mentioned, to be okay, talking with various people and getting multiple people to speak into your life.
Yeah. All right. And then going forward, I kind of want to ask you, since you probably have had plenty of mentors throughout your life, and I'm sure you've also served as a mentor in your current daily life, but what are some key aspects that you think a student should look for in a mentor?
I think that question depends on your own personality. For me, I prefer people that are blunt, and I do not like to engage in much small talk. So I would rather meet with an old friend and have 2 minutes of real conversation than meet with someone for 20 minutes and not really get much out of that conversation. I want someone to go into a meeting and tell me what needs to be fixed. I do appreciate constructive criticism instead of just blatant criticism that doesn't come from a kind heart. And there's some tact to that. But that is what I look for in a mentor, someone that will, one, give me their time. And they also value my time as well. So they're not just going to be rambling on the phone with me for an hour if, I'm waiting to go take care of my kids and do dinner and all that type of thing. I want someone that will, one, take the time out of their day. I don't want to be a burden to them. I want them to be excited to talk into my life. But at the same time, I want them to tell me the truth, even if it hurts, or give me the hard questions to ask myself that will help me grow.
Yeah, I think that is a really great takeaway, even if personalities do differ, but you really do want and need somebody, especially since we are in a field where time is money. Time is so important, whether you're a student and you need that time for studying, or you're a resident, a physician, and time is short because you're constantly practicing and your hours are long. I think it's so important to have those relationships where you can be straight to the point. So that way everybody's getting the most out of it and you're making the most efficient use out of your time. So I really appreciate hearing that. And then last, I just kind of want to ask if you have any final remarks or thoughts on mentorship in general.
Yeah. So now that you bring that up about encouraging and respecting someone's time, I would think that if you go to your mentor, try to have processed the initial emotional response if you are coming to them with an issue. Write it down in your journal or give it 24 hours to resonate and marinate in your body. Just process those initial emotions and recognize that if you're coming to something with an emotional attachment, that you acknowledge that. And it's okay to be coming to your mentor with an issue or advice, but please don't make them be the counselor that tells you, hey, you're being emotional about this and, you need to let this set for a bit. Just say, hey, I'm having a hard time getting over this grade or this professor that I'm dealing with or this audition rotation. I don't feel X, Y, and Z, or I do feel this way. How do I proceed? That is very respectful instead of taking your mentor's time and having them be your sounding board or your counselor. I think you'll get a lot more out of their time if you kind of pre-process issues that you have before just coming to them and calling them on the phone and doing word vomit over whatever issue you're dealing with. Because you're going to get a lot more out of that conversation, and they're also going to have a lot more bandwidth and energy to help you.
Yeah, I 100% agree with that, because I think oftentimes we don't really talk about the benefits that a mentor kind of also receives from a mentee and how that relationship goes two ways. So I think with what you're saying, it really makes sure that you're getting the most use out of your relationship with your mentor, making sure that, once again, they are not your counselor, they are not your therapist, and you're not just vomiting words at them, but also just so that way you're respecting their time and they're also getting benefit from not necessarily serving as your counselor, but being able to give good advice, because maybe something you're going through is something that they haven't really experienced yet, or something that they can share with other people they might be mentoring. But I believe that when you are a mentee, you're also giving really good and new perspectives to your mentor. So I believe that relationship does work better when you are making sure that whatever you are asking your mentor is kind of serving as a two-way street, whether that's bouncing ideas off of each other or just chatting about whatever you have concerns with. So,
yeah, I'd say the other thing I would say is don't be afraid to ask difficult questions with your mentor. I don't ever think it's appropriate to ask exactly what your salary is, but asking, hey, what is the salary range that, someone starting out might look like, and what might it look like 10 years from now employed in, somebody in your position, especially if they're, towards the end of their career and they're 20 years out. Don't expect that to be anything close to what you're going to be making because they're well established. But also realize that your mentor is not infallible, meaning they have their deficiencies as well. Us as physicians have a lot of strengths, but we're not always strong in everything. And so, realize where they may come short, whether that's in relational advice or business acumen or financial advice or how to raise a family. Just take the good and note where they may have fallen short, and just be realistic about that.
Yeah, that's really great, because I remember when I was in a mentorship program during high school, one of the most important quotes that I took away from that and was kind of pasted everywhere throughout their program was, you're the sum of the 5 people you spend the most time around. And I think that does really apply to mentorship relationships, where you do not have to be the sum of just one mentor. You can be the sum of many mentors who have different strengths in different fields. And then together you can kind of combine those strengths to make sure that you're living the life that you want to live.
Yeah, I can absolutely think of multiple physicians off the top of my head that I think had great business advice, great practice management advice, terrible relationships at home or all divorced, and then I've also seen people that, weren't the most financially prosperous, but had amazing family relationships. And by no means those two have to be together or separate, having a great family life and being financially prosperous. But just take the good, leave the rest.
Once again, thanks for listening. As we wrap up, I'd like to leave you with this quote by Sir Isaac Newton. "If I have seen further, it is by standing on the shoulders of giants."